earlier this year after hearing from more than 100 witnesses and reviewing more than 300 briefs. A parliamentary committee made 23 recommendations to improve Canada's assisted dying law. It wants the government to improve access to palliative care and boost financial support for people with disabilities so that people don't see medical assistance in dying as a way to relieve suffering due to poverty and lack of services. The committee also supports a proposed delay to expanding the eligibility for MAID for Canadians whose sole condition is a mental disorder. The conversation has renewed the urgent need to discuss and plan for end-of-life care here in Canada. So for more on what family and patients need to know, I'm joined now by Dr. Naheed Dosani, palliative care physician at St. Michael's Hospital and medical director of Kensington Hospice in Toronto. Doctor, thank you for your time tonight.
Thanks for having me on the show.
So just to start off, what is the difference between palliative care, which is delivered in a hospital, versus a hospice?
So just at the outset, so we're working from a common definition, palliative care is an approach to care that emphasizes quality of life for any person at any stage or any phase of a serious illness. As someone who works in the hospital setting, I often meet people who are admitted for their serious illness, for pain and symptom management, or other serious illness issues. And some hospitals here in Toronto offer a palliative care unit, and some patients might go there. But a lot of my work in hospital is transitioning people to other palliative care dispositions. One of those dispositions is home care. We don't send people alone with no help or supports. People are transferred to home with home palliative care supports through the home and community care system. The vast majority of Canadians, over 90% when surveyed, want to be at home. And so we really work to help people get there. And finally, another disposition is a residential hospice. I work at the Kensington Hospice in Toronto, and that's an example of a place where community-oriented, compassionate care is provided, not quite in a hospital setting, but in a more homey type, compassionate environment where health and social care professionals are available as well. And so those are some examples of where people can receive a palliative approach to care.
Yeah, and some different options for sure for those who are maybe going through that journey, and for those who are really starting that journey. I mean, how does one choose the right place for their loved one for their palliative care journey?
I mean, ideally, people are having these conversations very early on in their journey or even before they get sick. That's called advanced care planning. And I encourage people to check out the website Speak Up Ontario, where people can get more resources to learn about how to do that. But often people are thinking about this when they're either admitted to hospital or sick and at home receiving home care. Typically, home care professionals or healthcare professionals, care coordinators, transitional care coordinators are working with patients and their caregivers to navigate the complexities of the system. Typically, applications are put in where people can apply for a palliative care unit or a hospice or another kind of health facility to be in. I always recommend that people apply for 3 or more settings just because you never know if a bed will be available, and just to really hedge your bets and ensure there are options to get the kind of care and support you need when you're receiving a palliative care approach.
And when you talk about those options and getting that care that you need, how would you advise advocating for your loved one when it comes to palliative care?
Of course, this somewhat depends on the setting of where someone is at. But, what I would encourage caregivers to do is really talk to the healthcare professionals who are caring for your loved one. Often there's a propensity in healthcare and medicine to focus on the here and now, and I totally get where that comes from. But really ask your loved one's healthcare team where, your loved one is at on a trajectory. Look, I know my loved one has a serious illness. Where are they at on this trajectory? Where is this trajectory going? What does that look like 1 week from now, 1 month from now, 1 year from now? The other thing to ask is, I know you're focused on quantity of life treatments, but where are the quality of life treatments? Can we better support pain, nausea, constipation, or other symptoms that are affecting a person's quality of life? And finally, I would really encourage caregivers to ask questions about access to resources. Is my loved one someone who would be a candidate for publicly funded home care? In so many scenarios, I've met people who were totally candidates and didn't know that. And then also, is my loved one a candidate for something like a residential hospice where they can get help and support? And so these are some of the key questions that can really help along the journey.
And it can maybe sometimes be hard to navigate that and find the answers. But I do want you to explain to our viewers, if you could, what a power of attorney is in this context. I mean, how does that work? When does that kick in? How does that help?
Yeah, so now we're talking about a particular scenario where a patient has lost the capacity to make medical decisions for themselves. And in those instances, we often turn to someone else in that person's life. In Ontario, there's something called the Healthcare Consent Act, and it actually very clearly outlines a hierarchy of who would make decisions, when, and how. Now, sometimes people don't want their blood relatives to be the one to make decisions for them if they fall sick and can't speak for themselves. That's where a power of attorney for personal care really kicks in and can really help someone, for example, make their best friend be that person. This is not to be confused with a power of attorney for finances, which is a totally different concept to talk about. And so I encourage people to check out the Speak Up Ontario website and become more familiar with that hierarchy. If you are someone who wants someone who is typically not a blood relative to be your decision maker, it's probably important to think about filling out a power of attorney for personal care.
And can you explain, doctor, what is comfort care and how does that differentiate from general medical care?
Yeah, it's important to recognize that as people progress through their illness, people start to change their approach or what we call their goals of care. People are often admitted to hospital and are, receiving this general medical care that we talk about. But as people find that these treatments are less effective over time, they might choose to increase their quality of life treatments while decreasing their treatments that may not be impacting their quality of life and may not be actually increasing their quantity of life. For example, stopping chemotherapy or antibiotics or saying, I don't want to go to surgery. I just want to focus on my comfort and quality of life. For some people in these situations, we transition our approach to care to a more comprehensive, comfort based care approach. It's not doing nothing, it's doing lots. It's very active, it's treating pain and symptoms, it's providing emotional and spiritual support, and it's really helping caregivers through this very difficult journey. And it doesn't end at end of life, it also includes grief and bereavement. And I do spend a lot of time providing care for family members and caregivers after a death to provide that kind of bereavement support because these situations can be really, really hard.
Really hard, and I completely understand that, doctor, but also really confusing as well to try to navigate this, especially when you're going through so much emotion. So I do appreciate you coming on tonight and breaking that down for us and our viewers in terms of what is what. Thank you for your time.
Thank you so much. Have a good night.
That's Dr. Naheed Dosani, palliative care physician at St. Michael's Hospital.